Good day, and welcome to our presentation. My name is Bill Detmer, CEO of Unbound Medicine, and I'm thrilled to introduce today's speaker. Tiffany Gibson, BSN, MSN, is a rising star nurse educator whose passion and focus has been on professional development, particularly in the areas of healthcare equity and inclusion. Tiffany earned a bachelor's degree in public health from Temple University, a bachelor's of nursing from Drexel University, and a master's of nursing education from Walden University. We at Unbound Medicine are in strong agreement with Tiffany that diversity, equity, and inclusion are really central to nursing education and the practice of nursing, as it really is to all of medicine and society. As you will see, Tiffany's work is really breaking ground in this area by raising awareness, by providing curricula and curricular tools, and training educators about how to bring these principles to the classroom and into the practice on a daily basis. So without further ado, please welcome Tiffany Gibson.
Thanks, Bill, so much. And welcome everyone to Pathways to Inclusive Nursing. This is not going to be your average webinar. By all means, this is not a lecture. This is very much story time. And what we're going to go over in the next couple of moments is the 5 whys of inclusive nursing, our role as nurse educators, and strategies to enhance nursing curriculum and education as it relates to inclusivity in nursing. And so one of the things that I want to set the bar with and do some level setting is the terms for diversity, equity, and inclusion. Usually when we hear the word diversity, one of the first things that pops up is race, stereotypes, discrimination. And while all of that is important, what I really want to focus on is the inclusion part, right? So yes, the dialogue around diversity, equity, and inclusion is very broad and different people bring their own definition and values. But today we're going to focus on inclusivity and what that means in and out of the classroom. And so inclusion, for a very broad definition, is the ability to give both employees and patients a voice to help provide and receive high quality care, to reduce the anxiety, to encourage the presence of a diverse healthcare staff in the treatments of patients. It's a sense of belonging. It's a sense of psychological safety and embracing diversity, not only on the patient side, but on the nursing side. And as educators, we play an essential role in showing this in the classroom. So hi, let me introduce myself before we go any further. My name is Tiffany Gibson, and I am a self-proclaimed professional troublemaker in nursing. By trade, I am a clinical nurse educator. I work in the hospital setting as well as BSN programs in the city of Philadelphia. And one of the things that I love to do is integrate clinical concepts with equity and inclusion to show how they are needed in every single aspect of nursing. And so here we have the 8 hallmarks of excellence in nursing provided by the National League of Nursing. And it talks about excellence in nursing education being engaged students, diverse and well-prepared faculty, culture of continuous quality improvement, innovative evidence-based curriculum, innovative evidence-based approaches to how we teach, resources to support our programs, commitment to scholarship and pedagogical different functions, and we have effective and institutional professional leadership, which is all well. And as a nurse educator, I agree that all of these are hallmarks in nursing education. However, what I think is missing is integrating equity and inclusion in all of these different hallmarks because they do show up. So let's talk about where and how and why. So what are we referring to? The importance of inclusivity, because an inclusive nurse can clarify, amplify, and advocate ambiguity, complexity, and differences to maintain cultural safety, security, and respectful patient care, which is great. Who are we referring to? Nurses. But as educators, we are creating future nurses. So it really starts with us. And why is this important? Because we still have statistics like 2 to 3 times more likely to die for African Americans, American Indians, and Alaskan and natives from pregnancy, which is a huge issue. We also need to realize that over 100 million people in America identify as belonging to a racial or ethnic minority population. And so we need to ensure that our nurses who are going to be taking care of these people understand what inclusivity means, and not just as it relates to race and ethnic culture and religion, but inclusivity with thoughts, with expression, with appearance. And this starts with inclusivity of the students in the classroom. If they can feel this, and if it can be role model to them, it will be easier for them to do so when they become a professional nurse. So one of the things that I like to draw attention to as a Black woman who's also in nursing education is health disparities, social and economic inequities. Because one of the things we refer to in nursing education is how there are certain ethnic and racial populations who are at high risk for chronic conditions. And that's how we leave the conversation. We leave it just like that. For example, African Americans are at increased risk of having high blood pressure, but we never talk about the why. We talk about health disparities, but not the social inequities that come with that. So, me being a Black woman is not the only reason why I have a higher incidence of maybe having high blood pressure. It is my economic instability. It is my neighborhood and my physical environment. It is the stress of having no food. It could be my lack of education and my literacy. It could be the community that I'm in, social concepts, my safety, the fear for my life. And it could just be systematic racism, for example, the healthcare system. And all of these things increases my stress level. I'm not eating the best foods because I don't have access to the best foods. I also don't have the money to buy the best foods. And so I have increased cholesterol and sodium, increased high blood pressure, and all the things that come with it. And I just so happen to be a Black woman. But it's not because I'm a Black woman that increases my chances for this chronic illness. It's everything else that surrounds me, which includes the social and economic inequities. And so, as a nurse educator, as we teach nephrology and the kidneys and how blood pressure works, we should also put in the fact that high blood pressure can have an increased incidence in African American population, but it is because of systematic inequities. And that's how we can integrate the two. So with inclusive education, some of the things that I encourage you to include is demonstrating 5 strategies that will allow your nursing student to feel included in the classroom and understand the concepts of inclusivity. And these 5 strategies are getting to know your students and let them get to know you. One of the things that I've learned as I've grown as a professional is the importance of relationship building, the importance of trust and vulnerability, to ask for things that I need, to ask for help, to share my opinion and not be judged, to understand that it's okay and safe to put myself out there, to have my opinion be heard and validated, because then that increases my confidence in wanting to participate more in things. The same things happen to your students in the classroom. And so the more you get to know them outside of the textbook, and the more you share a little bit about yourself, the more you start to build relationships with your students to allow them to feel heard and seen. Next, we want to create a safe space for students to share. If they have a personal story at home in regards to a clinical concept, to include that discussion into the curriculum, because one of the best ways to learn is through discussion and conversation. We want to make sure that we're delivering our instruction in a variety of ways to be inclusive of different learning concepts. Long gone are the days where there is a lecturer with PowerPoint and all the students just sitting down writing notes. As educators, we need to differentiate and accommodate how we deliver education so that it can be inclusive to different people who learn and study in different ways. By role modeling that, our nursing students will then be able to see that it's possible for them to differentiate and accommodate their nursing care so that it can be reach and inclusive to all different patients. One of my favorite sayings of all times is the platinum rule, living life by the platinum rule. So we all know the golden rule, which is do unto others the way you want to be done to yourself, right? The platinum rule is do unto others the way they would want it to be done unto them, right? Because I don't know how you were raised, and I may not want you to treat me the way you want to be treated. That may be two different things. So for me, I would like to go above the golden rule and be platinum. And if we can accommodate our patients and do things that are culturally inclusive and allow them to invite some of their practices into healthcare and the treatment that they're receiving, it makes them a better patient. We also need to do the same in the classroom. And then we also have choosing relevant literature. Sometimes we need to look outside of nursing to find really good evidence-based resources and literature to include into our content to show different ways that we can be inclusive and invite guest speakers to share their stories. Anecdotal learning is probably the best learning because it makes sense to people. It's taking case studies and making it personal. And students will forever remember that one guest speaker who came in and had an issue with the one patient. The story will always be there. And so when you invite people to share their personal experiences into your classroom, it enhances the learning of your students. The other thing too that's really important with having inclusive education is to allow for self-awareness, to allow the students to think about how certain situations made them feel, to see if they had any implicit bias and then check themselves to see where did this bias come from, to talk with other people to see what their perspective on the same incident could be. We can be at the same intersection at all the four corners and look at one car accident and have a different version because we're looking at things out of our lens. And so when we allow students to be self-reflective, we allow them to learn, we allow them to think out loud. This also enhances critical thinking, and it also develops a professional identity. So some more tips on how to encourage inclusivity and demonstrate equality. We want to make sure that we're providing education through literature and work groups, create a sense of belonging, again, allow the students to share their views and give them a voice in decision-making, foster individuality, and provide opportunities to learn and develop outside of test taking, group projects, and papers. One of the things that makes my toes curl as an educator is when I see the light bulb go off on my student's head, literally. That's one of the reasons why I stay in education, and I am a perpetual student myself, and I live by the philosophy that knowledge is power, but sharing that knowledge is powerful. And I just want to read books all day and pour into nurses, and if I can do that for the rest of my life, I will be a happy Tiff. As educators, we have such a crucial, critical role in developing the minds of future nurse leaders. And we can relieve student anxiety and reduce stress literally by connecting with them on a human level. To ask questions for clarification, to allow them to ask us questions for clarification, and for us to not retort by saying, look in the textbook, because they're coming to us as the experts. And even if we don't know the answer, by saying, I don't know, I'll get back to you, builds trust. We want to make sure that we are communicating clearly, that we are listening attentively, that we are making eye contact, because in American culture, eye contact shows respect. We want to make sure that we seek assistance if necessary. So if equity inclusion is not your ministry, that's okay. There are a lot of experts in this field, inside and outside of nursing, that can help you. We also want to make sure that we have control of our emotions and that we stay calm and patient, even when we feel like we are being challenged. So This is a concept that we talk about in nursing often, which is patient-centered care, right? Where we as nurses make sure that we are aligning services to meet the patient's needs and preferences. So let's talk about this a little bit. Patient-centered care is comprised of three parts. We have coordinated, integrated, continuous care and services, where we are keeping the patient in the loop at all times. We are making sure that they are aware of changes and we are asking for their inputs. It also comprises of convenient and easily accessible care so that if the patient is unable to talk, there are other ways that we can communicate and that the communication is not hard for them to get to. For example, patient portals, patient may not have technology or internet Wi-Fi in order to reach the portal. So is there another way that they can get access to their daily plan of care or their prescriptions? And then lastly, we have attentive to health promotion and physical comfort. What we may think is best for the patient may not be what the patient wants. And I'll say that again. Just because we are the licensed professional with the stethoscope and the lab coat does not mean that we know what's best for the patient. The patient sometimes just want to be able to walk up the stairs, and that's really what their ultimate goal is. And so with patient-centered care, we are aware of these three components to make sure that we are putting the patient in the center and including them in all aspects. Now, what would the classroom be like if we had student-centered care? If we made sure that we were coordinated, integrated, and had continuous conversations and communication with our students at all times so that they're kept in the loop of changes and things that are happening, that we make sure that our education and access to us is convenient and easily accessible. So that if we have a patient who is using a wheelchair, that they are able to get into the clinical setting. That if we have a patient a student who is in the wheelchair, that they're able to be a nursing student. How about that? Because currently there's still a battle for students who have different mobility and need different assistive devices who are being turned away from the profession because we, the able-bodied person, think that they cannot do that. But then that leads me to the third concept, being attentive to health promotion and physical comfort. Sometimes what we think is best for someone is not what they think is best for them. And no one knows themselves better than them. Right? We are only in charge of ourselves. And so for us to tell someone what their capacity is actually doing a disservice and not being inclusive at all. And so now that you have these different strategies and I got your mind wandering and you're thinking different ways and you're questioning yourself and you're probably talking back at the screen. I know, I hear you. I know. But I want you to consider this. One of the things about change is that it's hard. One of the things about change is that we have to unlearn things that we've been doing and that we've been used to having a routine of so that we can get the new information in and then implement and execute on the new information. So how do we foster and sustain the change of including inclusivity in every single aspect of your clinical curriculum? Right? Because one of the things about change management is being proactive to ensure that the transition that you're making is going to be sustainable and is going to have improvements over time. So communication is one. Understand how to communicate different perspectives and how that's going to affect learning and patient care and also student nurse care. To be diverse, diversity and representation is extremely important. If you look at the statistics of nursing educators who are of color, the numbers are low, specifically African-American nurse educators. So we want to make sure that we are a reflection of our students, but then also that our students are a reflection of the patients that they're going to meet. And so there may need to be a conversation with your admin and admissions from nursing school to see who it is that we're teaching and putting out there into the workforce. We also want to think about cultural humility. In nursing school, we do a lot of talk about cultural sensitivity and cultural competence, which is great. Cultural competence meaning I understand that there are different traditions and social norms for certain groups of people, and we place value on those differences, and we are aware that certain groups of people may include these differences and social norms when it comes to healthcare. Great. let's take that up a notch to cultural humility, which is integrating these differences into what it is that we do at the bedside as a nurse. In seeking out and being proactive to ask what these differences are and making room and accommodations for these differences to live, to be inclusive, and to allow our patients to have a sense of belonging. The same thing needs to happen to our students. And then lastly, feedback. Feedback is a gift, but the thing about gifts is that it has to be present. And so I don't know if anything's wrong if no one tells me that something is wrong. So constant feedback, peer-to-peer feedback from student to student, but also student to instructor and instructor to student, and keeping that continuous loop of education going. This builds confidence, self-awareness, and an enthusiasm for learning where you are constantly getting feedback on your progress. And so lastly, to be an inclusive nurse, I want you to remember this. As a nurse, we are licensed healthcare professionals, right? We have the ability to take care of patients and people at their most vulnerable. To be an inclusive nurse is to be someone who is free to express themselves without bias so that they can work collaboratively with patients. And I want you to remember this. And the name of nurse rings very true and very loud. Nursing is the #1 trusted profession in America, but we need to be the #1 respected profession as well, okay? You understand that differences matter and that it's not just about the diversity, but it's about the inclusivity. It doesn't matter that I'm Black if you're not going to allow me to be my full authentic self when I show up. Respect the differences and have a respect for equity and belonging. Support people who feel marginalized and systematically oppressed. Support people who have had a history of not having their voices heard and amplify them as much as you can. And then explore different ideas and concepts. Explore your thoughts and feelings about things and have empathy. And with these things, you will be an inclusive nurse. And so to summarize what we've just discussed, I encourage you to provide context and assign value on the importance of inclusion, not only as it relates to the LGBTQ community and race and ethnicity, which those are the top 3 things that pop up when we talk about diversity, equity, and inclusion, but in every single thing we do as a nurse educator, with every single clinical concept that we teach, how can you make this to be more expansive and inclusive of everyone? We also have a responsibility to create emotionally intelligent and psychologically safe future nurses. And that starts in the classroom. There's a rumor out there that nursing school only prepares nurses to take the NCLEX. Let's move beyond that because we know as experienced nurses that there's so much more to this profession than the clinical skills. And then lastly, nursing is not just based on the pathology, right? Equity and belonging can be infused into everything. So I challenge you to open your lens, to be comfortable with getting uncomfortable and stretching beyond what you're used to see different ways that you can enlighten your future nurses and create future leaders. So thank you so much for watching this webinar. I appreciate you hanging out with me until the end. If you have any questions about this and want to continue the conversation, please feel free to reach out to me. I look forward to hearing from you. And thank you, Unbound Medicine.